This podcast is for information only and not medical advice. Please consult a qualified healthcare professional for advice specific to you. Today on the Authentic Me podcast, I'm joined by Bernadette Crosbie, a nurse practitioner, founder of Medicura, and a woman that has changed her entire health journey into empowering and impacting others. From multiple surgeries to being on stage for fitness bodybuilding competitions, Bernadette now owns a boutique clinic that blends evidence-based medicine with holistic patient-centered care approach. I'm so excited to share her story today. She is a powerhouse woman and one of my clients, but I'm also one of her clients. Please welcome to the show, Bernadette Crosbie.
Thanks, Mal. Thank you so much for having me. I'm really excited.
Welcome. This is one of your first times being interviewed, but I feel very privileged and honoured to be able to share your story with the whole wide world. And you've got such a wealth of knowledge in personal, professional, and beauty and confidence inside and out.
Thank you.
But I feel like you weren't always that. You weren't always the amazing nurse prac. Can you take us back to the very beginning and how you've ended up choosing to be in this field?
Yeah, excellent. So I guess I've been nursing now for 20 years. So it has taken that long to get to where I am today. But going back into why I do what I do, I grew up in a family that was very medical. My dad's actually a GP and my mum's a nurse. My sister's a physio. My other sister is a speech pathologist. We've all got a medical background and we actually grew up behind the surgery. So I was putting on Band-Aids from a very young age, helping dad in the clinic. And so it was really a natural progression that I was going to get into some sort of, medical field growing up.
So family obviously was a huge influence in that. Did your sister do the same thing, or was there ever any pressure to sort of, you have to go down this field, or it was just more the exposure and that's why you've kind of gone?
No, there was never any pressure. I wholeheartedly love looking after people. And so being a nurse, I'm able to look after patients, and that's what I actually just really love caring for people. And so it was a natural, easy sort of it was a natural road to sort of travel. There was no pressure from my family to be in the medical field, but it was what we grew up around. So I guess naturally we're exposed to it all the time.
Yeah, I love that. Now, you've been on both sides though. You've been obviously caring for patients, but you've also been a patient yourself in a lot of your own health journey. Without diving, too deep into your vulnerabilities, but can you give us some insight in how you've received care and now how you give care?
I guess I feel like I'm lucky that I have been able to be a patient. So whenever I've had something that's come up that hasn't been, I guess, the best case scenario, I've had multiple back operations. That's probably the thing that really jumps to mind. I've actually had 3 back operations. Each time I've gone through any operation or I've experienced anything, I've always thought, at least now I know how a patient would feel in that situation. I guess I'm able to empathize with patients so that I've actually experienced so many different operations or things throughout my life so far. So I never think of it as a negative. I always try to turn it into a positive. So whether it be, bowel operations, back operations, we've gone through IVF to have Bonnie and she was born premature. All of those experiences really do build my, rich tapestry of life to be able to then look after patients from a different perspective, having had those things happen to myself. And when a patient comes in and says, oh, I've got to go for this procedure, I've got to have this test, or I've got to do that, I can actually speak from a place of actually experiencing some of these things, which I find patients are more reassured by that. And so I suppose I'm using the negative and turning it into a positive.
Yeah, and I love that. And I think that's what you've done throughout your whole life. Every time you've kind of had these challenges, physical operations where you can't get out of bed, a lot of it comes down to your mindset and how you've been able to shift it around. And I also think it humanizes you, right? Like if you've lived the experience that your patients are going through, you really can empathize, like you mentioned, and know what they're going through. And I think a lot of times we feel like where the patient and professionals don't necessarily get us, but you draw in a lot of your lived experience and then you're able to share from that. Would that be correct?
Yeah, I think so. And I think it's only because I'm well and I've worked my way through all these things that I'm able and and it's a safe place for me to share that with my patients as required. I think if I hadn't overcome all of my things, then it wouldn't be a safe thing to do. But because I guess, especially when you think about weight management, for example, patients often judge books by their cover. And I'm not overweight, but I have been. And so I think it's not until you've actually been able to process the journey or the experience of having weight troubles that you can actually then use that to, help other people in their journey, and you're well yourself. Because I think that weight troubles are something that people can battle with throughout their whole life on all ends of the spectrum. So I think that giving patients that ability to know a little bit more about me actually helps them and gives them hope or puts it into a different perspective.
For sure. I think when you told me that you'd been overweight and you're like, I was the fat kid. And I'm like, what? Excuse me? Because we do. We judge a book by its cover. It takes us 1.4 seconds for us to make a judgment, and you present yourself so well now. But that's why I think it's like you don't know. You haven't always been this way.
And I think that's like everyone, though. We don't know what's going on in someone else's life. We see them for who they are on that day. But I think it's always nice to just remind ourselves that, until you ask someone their story or what's been happening, you can't truly know. But I think when in my consultations with patients at the right time, if there's an experience that I've had throughout my journey that I think would be useful to share with that patient at that time, then we do kind of talk about it, because I think it can make you feel less alone when you're going through difficult things.
Yeah, I love that. Yeah. Thank you for sharing. So let's wind it a little bit in terms of terminology, because I know that I was confused with the difference between a nurse practitioner, which is what your qualification is, and a GP or a doctor. Can you help us all?
Yeah, and I think that's the first place I start when I see patients. I go, do you know what a nurse practitioner is? And most people are like, oh, yeah, I think so. Most people think that we're a practice nurse, which is a nurse that works in general practice. And they have usually done a bachelor degree, and they're the same qualifications as what we would see most regular nurses in a hospital. Nurse practitioner, however, has done a fair bit more study, usually more study than a doctor, to be where they are.
Wow.
So a nurse practitioner has usually done 3 university degrees. So we've done a Bachelor of Nursing, then a postgrad diploma in some sort of specialty, and then a master's. So, and we've also, on top of that, need to have 5 years advanced level experience before we can actually do our master's. So we're 10 plus years before we're a nurse practitioner, registered with APRA. So that means as a nurse practitioner, we can diagnose, treat, manage and prescribe for chronic conditions or whatever is within our scope of practice. So we operate like a doctor independently of doctors. We don't have doctors doing our scripts. We're able to bill certain item numbers through Medicura if it's health related. We're able to order diagnostic tests such as blood tests. We're able to refer to specialists. If we need to refer patients to specialists, we can actually look after a patient's whole care within our scope of practice. Do you want to know my scope of practice?
Yeah, that was literally, you saw my train of thought.
I did read your thoughts. And my scope of practice is aesthetic medicine, weight management, longevity medicine, and also alternative plant medicine, including hormone health and a few other bits and pieces like that. Generally, I describe it as patients as making them feel well inside and out. That's my scope of practice and what I do. So when a patient comes to see me, I will always say, don't get rid of your GP. I'm not your GP. Yeah. And quite often I work together with GPs. We share blood test results and we keep each other on the same page. But I'm really trying to keep people well and optimize health is where I see that's my passion. That's what I love to do. Quite often, a GP is making sure that you're well and that you don't have a cancer and that you're not got a cough or a cold. And so they're really good at that acute phase health. In my practice, I like to optimize your wellness. So we're not just making sure your levels are at an adequate level, we're making sure that your levels are at the optimal level for the best health possible. That's the difference that I see. GPs don't often have the time to be able to optimize health, and they're so busy, and there's a lot of pressure put on the general practice. So I think having a bit more time for patients is something that I know my patients' feedback is really positive, and they love being able to sit down and actually, optimize their wellness rather than just being acceptable.
Yeah. So keep the GP, but also invest or explore having a nurse practitioner within your health team as well.
I think so. And it depends on each individual. Like nurse practitioners don't usually work in private practice. So most nurse practitioners actually work in the hospital. So you won't see many nurse practitioners in private practice. I think it's becoming more common and more popular, but we definitely look after patients from a place of nursing. And so nurses are, built to care, and we still follow a medical model, but we have the compassion of a nurse, or the heart of a nurse, we say.
I love that. I've never seen it that way. So that's really awesome. And when you talk about all of these scope of practice that you have, it feels very holistic. Like when we're talking about optimizing your health, you definitely have a very holistic approach. And when I've stepped into the Medicura space, I've also felt very safe, and you do treat everything. Like you kind of look at me from like, okay, well, what are all your biometrics? How have you slept? What is the goal? How important is that for you and in turn your clients?
I think having done fitness modeling and like bodybuilding type competitions, the emphasis was very much on the external and just how you look. But I think over the years, and I guess as you learn what's important, it's also how you feel. And it's probably the better you feel, the better you look. And so I don't think you can have one without the other. So it is so important at Medicura that we are truly health and aesthetics. So that's why I do what I do. And I think that quite often a patient will come into me and say, oh, I'm worried about how old I look, or fine lines or wrinkles, and that's what they're focused in on. My first place to go to, how much water are you drinking? Are you getting enough sleep?
Yeah.
Are you wearing sunscreen? Like there's a lot of things we can do without necessarily treatments or procedures or injectables that actually will make them feel better straight away and don't cost very much money. And I think a lot of clinics miss that and they forget the basics. And that's where I think we can do, we've got to look after the inside and the out, look after the whole person.
And you've definitely done that. I'm first to sort of like not put myself to shame, but I came in, I think it was like I wanted my lips done, like lip injectables. And Bernadette's like, that's not happening today. And really getting me to focus on like my skincare or like banking up my collagen and just prescribing something different to what the patient might be coming in thinking that they want. But you've been able to re-educate me on some other things that might define beauty. But the main thing has been like, inside and outside, that health and confidence and beauty. So
that's my priority. My priority is to give the patient the best possible care for them. And we don't know what we don't know. And that's the problem, I think, with a lot of all the information out there, or lack of information out there, is the fact that you come in as a patient and you don't know what other things might be available to you. And without me educating you, you will never know. So it's easy just to do what you want me to do, but it's better for me to actually educate you and take the time to do that so you get the best possible results.
100%. I want to move into some of these educational parts because I think it's really important that we actually understand all of these buzzwords that's happening in the media. So one of them is weight loss medication. I think a lot of people can attest to where is it good? Is it bad? What are the misconceptions? There's so much around weight loss medication that's happening in the media right now. Can you sing to that?
I guess in regards to weight loss medications in the media, there is a lot of negative hype, I suppose, about these sorts of medications. The main thing I take home, and the thing I'd love to make sure patients and the public are aware of, basically they need to be monitored. And that's where I think people are going drastically wrong. They're a Schedule 4 medication a lot of the time, and that means that they need to be titrated, monitored, side effects need to be addressed. And when they're used willy-nilly, that's where I think they do get a really bad name or a really bad impression of what they can do. On the flip side, we know some of these medications are absolutely life-changing for patients that need them. And so when used correctly, they literally are life-changing and life-saving, in fact. So I think the main thing that I would encourage people to research is speak to your health professional and get the right information and make sure the person that's guiding you through that is actually experienced in using these types of medications.
What are the questions that they can ask to see if they are the right practitioner? Or
when I think about the best sort of person to support someone in a weight loss journey, it's someone that's got experience. Or weight management, it's not even just weight loss. Weight management itself is a specialty in its own right. And I think it needs to be handled in a way that patients have the best care because it's very complex. It's not simple. It's not as simple as saying eat less and move more, which is what a lot of GPs will say to patients. And I have so many patients coming to me frustrated, upset, tired, because that's the information that they often get. And it's a hormonal response. It's a lot bigger than that. And I think it would be doing it not justice to just sort of give a short answer.
yeah,
It's something,
eat less calories.
yeah, it's just so much more complicated than what people think when it's truly a weight management problem. And it is a chronic condition. So when we talk about weight management, the thing that we often don't talk about is it's usually ongoing throughout a person's life. If someone's been overweight in their life, they're more likely to be overweight for the rest of their life.
Right.
If the government called it a chronic condition, they would have to pay for it and the medications associated. And we just don't have enough Medicare money to be able to pay for weight management because it affects so many people in the population.
I've seen online that you've got a special or like you've got a unique approach, which is like a 4 pillars approach to weight loss management. I can't remember them. So can you please explain what those 4 pillars are and how you treat that?
Absolutely. So when I talk about weight management, the best way to treat weight management is using a 4-pillar approach. So quite often when people try to lose weight, they'll focus on their nutrition and they'll focus on exercise, but they'll quite often not focus on their hormone health, their metabolism, and also the psychology behind weight management. So the Medicura approach is a 4-pillar approach. We attack it from all angles to give the best possible long-standing results because we want this to actually be life-changing. And then we don't want people yo-yoing up and down. So the 4-pillar approach is focusing in on diet or nutrition. So making sure we've got all the right nutrients and the right macronutrients to sustain health. We're then looking at activity or exercise. That doesn't mean going to the gym necessarily. It's actually finding the right type of exercise for the person and their lifetime. So in terms of where they are in their age. Then the 3rd pillar is around metabolism and hormone health, making sure everything's operating right from the inside out so that their body's functioning well. Sometimes we use medications in that pillar, that 3rd pillar. Not always, but we're optimizing the patient's body so that they actually can metabolize things correctly. And then the 4th pillar is around the psychology of weight management. So making sure people have long-lasting approaches and tools so that we're addressing things like self-soothing, we're addressing things that may contribute to then weight regain into the future. So often people use food as a way of coping with emotions. So we're actually trying to go, okay, well, if we take away eating as much, we still need to self-soothe that emotion.
Yes.
So being able to have a box of tools that we can actually use so that patients can actually, have long-lasting results for weight management.
And so they're well equipped, right? Like it's, okay, not going to go for the box of chocolates. I need to go for something else.
Yeah, because your body still wants something. So food actually, can increase our serotonin. And so it does make us feel good. So what other things can we do that also make us feel good? That is a healthier behavior than eating food or whatever else it might be. Yeah.
And I know you have an older demographic of women as well coming through your clinic. Can you speak to weight management and hormone health in relation to like perimenopause?
Absolutely. And I guess it's not just older women. So when we look at perimenopause, perimenopause precedes menopause by often 10 years.
Right.
So this is like we're seeing.
There's another misconception.
There is. There you go. It's myth has been busted. Basically, perimenopause can start as early as your 30s. So it's not older women. And I think that, yes, this time of our life, our body does change. Our estrogen decreases and our potential for abdominal weight gain and slowing of metabolism and many other changes that happen do often mean that weight does become an issue that may have never been an issue, or it may change our bodies in other ways. So yes, at Medicura, we do definitely see a lot of women. So women's health is something that I'm very passionate about.
How can someone as early as their 30s know that they're going through perimenopause? Are there certain symptoms? Is there any other changes that's happening to them?
Often, so we can have a little bit of a guideline based on your family history. So when your parents or when your mum may have gone through menopause, if you know that sort of information. But often it might show up as, altered mood, depression, agitation, or your skin just might start changing. So the oils in our skin will change. And we know that in the first 5 years post-menopause, the collagen decreases by 30%, which is absolutely crazy. So we can often see lots of different signs and symptoms that can kind of help us to put together the facts so that we can address that and we can help prevent those sorts of decreases in collagen.
How do we do that? Because now I'm like, I need more collagen.
So we can bank collagen. So there's procedures that we can do to bank collagen. But I guess speaking to a professional that's actually experienced in hormone health and that knows what they're doing, and whether you're looking at HRT or being able to replace or, bring your hormones up to a normal level is something that we know there's a lot of evidence to show that ongoing, this is actually going to ensure our bodies remain healthy. So it'll decrease our risk of osteoporosis. It'll also decrease our risk of heart disease, being able to keep our estrogen levels at a normal level. Yeah.
And you did mention HRT just then. So can you explain a little bit more about that? Because again, I think there's stigma around it. How do you know it's safe?
And this is a really interesting topic for conversation, isn't it? I think that you need to speak to your trained health professional when you're looking at this, so it's individually tailored to your own concerns. A lot of studies that have been done in the past around HRT have now been shown to not be completely statistically significant. So I would encourage anyone that thinks that they're going through perimenopause or approaching that time of life to really speak to their doctor, nurse practitioner, or someone that's experienced in this field, because there's so much to gain from HRT done correctly. Does that help answer the question?
I think the thing that I'm hearing throughout our conversation here is that, like, you don't have to do it alone as well. Like, there are so many people that are experiencing their zone of genius that can provide insight and the right education around the things that we might be going through.
Absolutely. And if you don't get the answer you want, go and ask someone else. So the biggest thing I've found, especially in my own health journey, is if it doesn't feel right, then go and get another opinion. Often patients know best. And I say that to my patients all the time. They're sitting there. I'm like, you know the answer. Like, you've got to believe, like, you've got to go with your gut. And that is, I can't emphasize that enough. Like, my patients tell me what's wrong with them. If I listen long enough, we'll uncover the right decision together. So if you go to someone and you're like, I'm not sure, that didn't feel right, or that answer didn't sort of sit like what I thought it would, go and get a second opinion. Always go with your gut in terms of that. And especially when it comes to HRT, I think a lot of clinicians do it really well, and a lot of clinicians aren't as experienced in it. And that would be what I would encourage people to do.
Really finding that scope of practice, I think, as well, is like, okay, what do they specialize in? And go there.
It's so true. Like, we can't be good at everything. No. And so a lot of the time a doctor will be there, like their passion will be something else. Their passion might be skin. It might be, certain respiratory diseases. It might be gut health. Who knows what it is, but we can't all be good at everything. But when you want something that's specific, make sure you find someone that knows a lot about that thing. And then that's where you're going to get the best answer and the best care, and go with your gut. Just, listen to yourself. Yeah.
Self-awareness is key.
That's it.
There's another, I think, buzzword that's in the media at the moment as well that I'd love your insight and education around, and I do believe it's your scope of practice, which is longevity medicine.
Yes.
A lot of people are talking about longevity. My partner is always saying how he's going to live to 120, 150 in this lifetime, and which we really might though. So can you explain what longevity medicine is? And the two words, I think, is the difference between health span and lifespan.
Yeah, and I think we know now that the person that's going to live to be 150 have been born now. Isn't there, statistics around that? So I guess this tells us we're going to live for a long time. And with modern medicine, we can keep people alive because we've got all these fantastic, treatments and medications and all these sorts of things. But I guess the difference between health span and lifespan is how well are you living? So we can live for a really long lifespan, but what's your health span? So when you're 120, are you out walking your dogs and enjoying, coffee with friends, or are you in bed in a nursing home, not able to do too much? And so that is the difference between our lifespan, which is how long we live.
Chronological age.
Absolutely. Yep. And our health span, which is how healthy we're going to be until that point. So longevity medicine is really about optimizing your wellness and your health. And I think people should be, or I know I am, I want to be healthy. I don't just want to live for a long time. I want to be able to enjoy my life. And so there's so many things that we can do with lifestyle intervention, which is based around longevity medicine, that can actually help facilitate that or improve our outcomes, our health outcomes. And so we look at testing such as epigenetics testing, which is working on methylation of DNA, which we can actually change. And that can be based on certain types of foods that we eat, certain supplementation, activities. So we know exercise is a really, big tool in terms of improving our health span. So anything like that is longevity medicine. Some of the testing we actually do is able to tell us the age of our organs, so that rather than taking, oodles and oodles of supplements and hoping for the best, which I think a lot of us have been there and done that, we can actually focus in and target on your body specifically. Like, what does Mel need? Not just general kind of rules. We can actually pinpoint it, and then we can actually retest and see those factors improve. So I think all these sorts of things that we're able to test helps to keep us accountable, but also helps to show that it actually is making a difference rather than just kind of hoping for the best. So being a nurse practitioner, I am evidence-based. So I don't want to just do something because, hope for the best, cross my fingers and toes. I want to do something because it's proven and it's proven to be effective. And I don't want to waste my money. And I think that's probably, a really important thing when people are looking at all the different options around longevity medicine. How are you measuring it? And epigenetic testing gives us a way to measure that, which is it's really cool.
So that's something that you can do. So if someone's like, I want to, and epigenetics just sounds really complex. But it's something that if someone was curious to know it, they can come to you and you break down all of the different measurements and you can optimize to the specificity of an organ?
Yeah, absolutely. Okay. And we can also work out how quickly someone is aging, so their pace of age. So whether they're aging a year, or are they aging 3 years a year? Or are they aging half a year? Does that make sense?
Yeah.
So you can actually, you can kind of go backwards in time in Benjamin Button.
Well, I have heard that some people were like, I've got a, organ or whatnot of a 25-year-old as in their 30s or 40s. And I've never actually really, I'm like, okay, whatever that means. But now that all kind of makes sense that you've got your chronological age, but then you've got your kind of internal health age as well.
Yeah, and it's just about knowing your numbers. So actually having that information to then make an informed decision if you want to do something about it or not. So this isn't for everyone, and that's fine. But I think some people do want to be able to, we go to all this effort of exercising or doing, taking supplements, and this gives us the ability to actually really tailor it to each individual so that you can see it actually working, which I find it really exciting. And patients do too, because it's you can see your
it's
numbers
really
changing.
Insightful as well. Like literally it's insight into your own body. So yeah, it's definitely something that I'm seeing more and more popular in a lot of the wellness centers and the gyms. They're offering these kind of services now around longevity medicine. So thank you for sharing.
I think too, the thing that we can't underestimate, and we go back to this right at the start, is your internal health shows on your exterior. So if you feel good inside, you're going to look better. And so a lot of this longevity medicine, it goes hand in hand with all of our aesthetics. So I find that patients that do longevity medicine do have a better, their skin is healthier, their eyes are brighter, their hair does grow better. All of those sorts of factors, they work synergistically together. And that's why we do health and aesthetics.
Yeah, there's so many people, so many thought leaders at the moment where they're showing those photos of them 20 years ago and them now, and they do look better. Like they look younger, they look more vibrant. There's a certain glow to them. So it's a really fascinating space to watch.
Yeah, and it's just getting more and more like
advanced.
Yeah, absolutely, and it's exciting. It changes all the time, and so being able to be at the forefront of that, it's so exciting. Yeah.
So if you want to live to 150, guys, go chat to Bernadette because we're all just going to be walking.
No, but it's not just living to 150. We want to be, walking our dogs and
by
really.
Living, I mean, living fulfilled, active, running marathons.
Yeah.
I love that. I want to finish the next sort of little segment around you are a nurse practitioner. We've established that. You've got an incredible amount of lived experience and knowledge. But it's not to deny as well that you're also a businesswoman, absolute powerhouse of an entrepreneur around taking that big leap and opening your own clinic. You kind of mentioned at the start is not many nurse pracs are in private practice, but yet here you are.
Here I am.
So what crazy got you to opening up Medicura, and what does it actually mean to you to have this business and have this space?
I just wanted to be somewhere where I wasn't at work, and I wanted to walk into the place and it to smell good and feel good and be a safe place for patients to come. I've worked in general practice. I've worked in corporate, practices. I've worked in, laser clinics. I've worked in all sorts of different places, and I just wanted it to feel like home. And I think that's what we've achieved. And that's when patients come in, it smells good, it feels good, they feel relaxed, and I wanted to be able to have my little space that I could look after people, like really look after people and be able to, know everything about them and their journey. And that's what we've found building Medicura, it's a family. It's not just a business.
Yeah.
And I think that people, once they come to Medicura, they don't really leave.
Yeah, you get a lifelong customer.
Yeah, I feel so privileged to be able to look after people and them to trust me with their health and their families. We often have, the mum comes and the daughters come and the dad, like it just grows, and it's just so nice to be able to do that. But I really just wanted to have a place where I could put all my knowledge to use and be able to help people. That's why I started Medicura.
And I mean, one, I can attest to that in the sense that people do feel incredibly safe. It's such a warm, welcoming space. But I feel like the difference as well between you and other clinics and areas is that you blend this like art versus science kind of mentality. It's not one or the other. You kind of really integrate both, which normally don't really coexist. Can you explain more about how you've done that?
Well, it is. And I think that's developed for me over years. Like, I think I was always a very A-type personality, and it was like A plus, but 1 + 1 equals 2. However, medicine and aesthetic medicine isn't an exact science. There is an art form to it, and it is about listening and tailoring things to the individual. And we don't have all the answers, and it's being okay to not have all the answers. So yes, especially, aesthetic medicine, it's very artistic. It's not something that and I love art. Like, I've always, had a creative aspect to things, but it's being able to have the foundation of the evidence and knowing like the facts that we know, and then being able to then implement them into the artistic version of that. And it's only with years of experience that I've actually confidently able to do that. I don't think that's something that I would have done when I first
graduated.
No. This is and I think the more, the older we get, the more we know. And I just feel lucky that where I am now, I am able to really, put those two elements together and listen to my patients and what they need. And yeah, it's definitely a mix of the two.
I think there's one thing that you don't know, and I think for a lot of this question goes out to all of you and your colleagues and other people within the industry from a B2B perspective, is what is going on with the TGA laws.
Oh gosh.
So I know that
every time someone, I think that in all honesty, the TGA laws and the APRA regulations are there to keep patients safe. Mm-hmm. So we can't forget that, and that's the main reason. So I'm all for keeping patients safe. And I think that a lot of the cosmetic aesthetic industry and some of the other telehealth industries are a little bit rogue at times. So I can see where it comes from. However, we can't educate patients if we can't talk to them about anything. And so that's where it's a little bit tricky and challenging at the moment, because patients come into our clinic not actually aware of all of the different treatments or modalities that are available to them, because we legally can't talk about things online or, marketing or, on any sort of, avenues, social media websites, which makes it really tricky. So without a medical consultation, we can't actually get to the nitty-gritty. And I find that often on a daily basis, whenever I have a patient come in for a new consultation, I'm always educating them about things they just didn't even know, which is good that we're able to, but it would be nice if they had a bit more opportunity to also learn outside of just that consultation. So it is tricky.
And so for someone that's out there listening today and something has sparked them around whether it's longevity medicine, weight loss management, aesthetics or plant-based alternatives, what is the next best step for them? Is it to book in a consult? Like, how do they even get to work with you, for example?
Absolutely. They can book a consultation. So booking a consultation is the best place to start. We do face-to-face. We do online telehealth. We also do webinars. We do little workshops. So there's many, many, many avenues where they can reach me. Happy to help anyone that wants more information.
I love it. And I've got two more questions before we wrap it up, and I'm so appreciative of your time. Thank you so much for being here today and just being such a big ball of wisdom. One is, you mention online on your social media platform a lot around your why, and your why being Bonnie, as well as your family. And she is just such a ball of energy. But can you explain or share what motherhood has brought you, what it's taught you, and how special it is for Bonnie, but maybe what it is that you hope that she sees in you or herself growing up when she's a bit older?
Yeah, well, I think to start with, Bonnie probably has taught me so much already. Her welcome, her introductory to life was her arriving at 27 weeks, 3 months before she was due. And I think that sort of, in a nutshell, tells me exactly why she is the way she is. She's a very determined little young lady.
Yes.
And so she showed me from a very young age that I don't have control over anything, and we've got to be flexible and we've got to just go with life. I think my vision of being a mother was probably going to be a lot more planned, and I thought I'd have everything all put together. But the reality is it's just not like that. And so being able to get good at being flexible is something that being a mother now I'm able to do. In terms of what I want Bonnie to see of me, I just want her to be able to do whatever she wants to do, and there's nothing that she can't do. And being able to help people is something that she's already passionate about, which I'm passionate about. And being able to, live life and just be able to enjoy things. You don't know what's around the corner. And I think that, just being able to enjoy the little moments, whatever silly things they are. You don't need a lot to have fun.
And you guys have so much fun. You have so much fun over on your socials. You have so much fun cooking together, playing together, really being present in that moment. So I can't wait for her to be able to watch something like this evergreen content, and just be so proud of her mama. So
Thanks,
you're doing such a great job. So just to wrap things up, this podcast is called The Authentic Me, and it always ends with asking, what does authenticity mean to you?
I guess authenticity to me is just being able to be proud of me. And so I'm not embarrassed about what my life is or what I've been through, or you can ask me whatever you want because I'm completely comfortable with it. And I think the thing about that though, Mel, is I've probably not always been like that. And so it's taken me a while to actually just be able to sit with just being me. And it's so nice. And that's, yeah. And I thank you for your help with that over, a journey. And I think as we get older, we get wiser. And so I can't wait to see what I'm like in another 10 years.
Yeah.
Like you just keep growing. And I think, does that answer your question?
Absolutely. It was more than enough. And like I mentioned when we started this conversation, you are such a ball of light, so much knowledge and wisdom. I'm so glad that we got to have this conversation today. Continue to empower all of the people that come through your clinic and through your telehealth. And just one final thing is, where can people find you and start working with you?
So on any of our socials, you can find me personally, Bernadette_Crosbie and Medicura.au.
Amazing. We'll leave them all in the show notes.
Thank you.